Today we will be discussing about the topic for thoracic duct. The name itself is suggesting thoracic duct, a duct that is present in the thoracic cavity. But it's actually a misnomer. It is not only present in the thoracic cavity, but its origin is in the abdominal cavity. Then the entire course it goes through the thoracic cavity and then drains into some veins at the cervical region. Right. So as this duct is majoritarily passing through the thoracic region, and hence the name is given as thoracic duct. It doesn't mean that it present only in the thorax. Okay. So what is this thoracic duct? What is its length? Where it is originated? Where it ends? What are the relations? These are the things that we will be discussing for today. First, there are some features with the rough thoracic duct. So what are the features is, first one, it has a beaded appearance. It has a beaded appearance like this, as shown in the figure. Why it is a beaded appearance? Because inside these projections are functions like a walls. So as there are multiple walls throughout the length of the thoracic duct, and hence it appears as a beaded structure. So it is a beaded appearance. Now inside this, what is present is a milky white structure of fluid. Milky white fluid. So whatever the fluid that is inside is a milky white fluid. Why is a milky white fluid? Is because it consists of fat digested products. See, actually we have capillaries where arterial the oxygenated blood that will be coming towards the capillaries that crosses into the tissues, and oxygen carbon dioxide is exchanged. And majority of the fluid that is exchanged in the capillaries will be collected by the veins. But a small portion of fluid is still persisted there, which actually collected by these small lymphatic vessels. And these lymphatic vessels has to drain into lymph nodes, and from the lymph nodes they has to go into the bigger parts of the, lymphatic vessels, and that bigger lymphatic vessel is thoracic duct. Okay, so whatever the fluid that is left at the level of capillaries is collected by these small lymphatic vessels. Ultimately through the lymph nodes they will drain into a big lymphatic vessel, and that big lymphatic vessel now we are discussing as thoracic duct, right? So, and it's why it's milky white appearance, because of this fat digested products. And total the lumen size is approximately 5 millimeters in size. The diameter of the lumen is 5 millimeters, and the entire length of it is 45 centimeter. 45 centimeter. Where from where to where we will discuss. Where is the vertebral level it will get originated and where it ends. All these things we will discuss. So in the thoracic duct, what are the features? First, remember it's a beaded because of its more numerous amount of walls are present, and deep inside we have a milky white amount of the fluid because of the fat digested products are there, and the lumen size is approximately 5 mm diameter with a length of total 45 centimeter. These are what the basic introduction of the thoracic duct. Now where to where it will be extending, you'll see now. Let's imagine this is vertebral level L2 and this is vertebral level L1. L2, L1. In front of these vertebral levels of L1 and L2, there is a dilated part is present that is called as cisterna chyli. This is called as cisterna chyli. Some people will chyli, some people chyli, whichever is convenient, but the spelling has to be correct. That's the cisterna chyli, which is present at the level of L1 and L2. Just above the L1, we have T12. That means the T12 vertebra is present. From this lower border of T12 is actually the origin of thoracic duct. Lower border of T12 is the origin of thoracic duct. From there, it will be extending up to the level of T5 vertebra. Let's imagine this is a T5 vertebra. So this will be extending up to the level of T5 only. But it does not deviate from it does not leaves or it does not ends at the T5. Instead, it just deviates towards the left side. For example, here it is in the midline. Now it is deviating slightly towards the left side. but is present in front of that vertebra only, and will be extending up to the level of C7 vertebra. And at that C7 vertebra, it form an arch. It form an arch. And that arch will be draining into the junction of two major veins. One is the internal jugular vein, the other is the subclavian vein on the left side. So this is the left internal jugular vein and this is the left subclavian vein. Both fused together forms the left brachiocephalic vein. Right? Into this junction of left internal jugular vein and left subclavian vein, this thoracic duct will be draining. Right? So origin point is at the level of lower border of T12 and it extends into the thoracic cavity up to the T5 where it is slightly deviated towards the left side. So let's imagine this is the left side and this is the right side. So slightly deviated to the left side, slightly deviated, but still present in front of vertebral column only, and goes up to the level of C7 where it forms an arch and then drains into the junction of left internal jugular vein and the left subclavian vein. So whatever the small lymphatic vessels that will be connecting, it enters the lymph nodes and ultimately into the major duct of this thoracic duct. Now this thoracic duct ultimately drains into the veins. See, whatever the fluid, it has to be collected by the veins, but it passes through another route like thoracic duct and ultimately draining into the veins only. Right? So this is what you have to understand. During this course, through which structures it is passing means, in front of T12 vertebra, there is a opening called as aortic opening. We have diaphragm, right? Diaphragm is separating that of upper thoracic cavity and the lower abdominal cavity. Now this diaphragm has a opening called as aortic opening. And through this aortic opening, this thoracic duct is coming. So what are the boundaries of that aortic opening? Is anteriorly we have the median arcuate ligament. Median arcuate ligament in the anterior side, and towards the right side there is a vein is running called as azygous vein, and towards the left side an artery is descending that is called as descending aorta. So at this level the boundaries, that means at the level of aortic opening, what are the boundaries? We have anteriorly the median arcuate ligament. Please don't confuse medial and median. It is median, N. Posteriorly, we have T12 vertebra. On the right side, we have azygous vein. And on the left side, we have descending aorta. Right? So these are the boundaries at the level of starting point. That means at the level of aortic opening in the diaphragm. Anteriorly with the median arcuate ligament, on the right side we have the azygous vein. So this is the azygous vein. And this is the aorta. And on the left side we have the aorta. Posteriorly we have T12 vertebra. So these are boundaries at the level of T12 at the point of origin of thoracic duct. Once it enters in through the aortic opening from the abdominal cavity, now it enters into thoracic cavity. And which part of the thoracic cavity it enters is, it enters into that of posterior mediastinum. So when we had discussed in the posterior mediastinum, we had said the contents of posterior mediastinum is the thoracic duct also. So that thoracic duct now enters here in the posterior mediastinum. Now in this posterior mediastinum, what are the relations of these? Is here there is a major structure which will be passing in the oblique way, that is called as esophagus. So this is the esophagus. Right? For this, in the so second level is posterior mediastinum. First level is at the level of aortic opening. Second is at the level of posterior mediastinum. In the posterior mediastinum, what are the boundaries? Anteriorly, we have the esophagus. Posteriorly, we have the thoracic vertebrae, because it is passing in front of all the vertebra and its intervertebral disc. So I'm writing here as thoracic vertebrae. And towards the right side, we have the same azygous vein. And towards the left side, we have the descending aorta itself. So this is the boundaries at the level of second, that is the posterior mediastinum. And from this posterior mediastinum is a part of inferior mediastinum. Now it crosses the sternal angle at the level of lower border of T4 to enter into superior mediastinum, right? So the third level is this one, which is at the level of superior mediastinum. Superior mediastinum. Now, in this superior mediastinum, it is difficult to show all the relations. So, I am doing the transverse section of this superior mediastinum. A transverse section. Okay. Now, whatever you are seeing is the anteroposterior view. Now, I am doing the transverse section. So, the transverse section of thoracic duct at the level of superior mediastinum, how it will appear, we will see in this section. Let's imagine this is a thoracic duct at the level of superior mediastinum. This is thoracic duct, TD. And posteriorly, we have the vertebral column. Which vertebrae are present? Thoracic vertebrae. Thoracic vertebrae are present on the posterior side. Now, what is present on the anterior side is we have the arch of aorta with its one branch called as left subclavian artery. Okay. So, anteriorly, we have arch of aorta plus left subclavian artery. And towards the right side, there is a structure called as esophagus. This is the esophagus with its central lumen, and the surrounding the brown part is the muscular part. So this is the esophagus on the right side. And towards the left side, we have the lung. Which lung on the left side? Left lung with its surrounding pleura. So left lung plus pleura. Okay. So what is present on the anterior side? We have the arch of aorta with left subclavian artery. What is present on the posterior side? Thoracic vertebra. Towards the right side, esophagus. And towards the left side, the left lung and the pleura for that of thoracic duct. Right. So this is the orientation: anterior, posterior, right side, left side. So this is the level of thoracic duct in the superior mediastinum transverse section and its relations. Now, once it crosses out of the thoracic cavity, now it enters into the cervical region where it forms an arch. So if you do the transverse section at the level of arch, that will be the fourth relation. So at the level of 4, what is the relations? Here is, let's imagine this is the vertebra. Now these are cervical vertebra. Please remember, now we are at the cervical region. These are the cervical vertebra. And just in front of the cervical vertebra, we have the prevertebral fascia. So this is the prevertebral fascia. And in front of prevertebral fascia, we have vertebral artery, vertebral vein, and just behind there is a sympathetic trunk. And it is present in the cervical region, so it's a cervical sympathetic trunk. So this is called as vertebral artery. This is a vertebral vein. VA means vertebral artery, VV means vertebral vein, and this is a sympathetic trunk, ST. As space is very less, so I am just concising with the small abbreviations. So anteriorly, this is the internal carotid artery, and this is the internal jugular vein, and this is the vagus nerve. Okay. In between these two, the thoracic duct actually is present. So this is a thoracic duct. So can I say that anterior to that of these thoracic duct in the cervical region, we have the carotid system, and this carotid system is formed by these three structures: vagus, internal carotid artery, and internal jugular vein. So it is a carotid system. Whereas on the posterior side, we have sympathetic trunk, vertebral artery, and the vertebral veins. That's called as vertebral system. Vertebral system. So in between the carotid system and the vertebral system, the thoracic duct is arching. And this arch ultimately drains into the junction of the left internal jugular vein and the left subclavian vein junction, where it forms the left brachiocephalic vein. So this is the ultimate course. So we had discussed the relations of this thoracic duct at 4 levels. The first level is at the level of aortic opening, which is present in the diaphragm. The second is the posterior mediastinum and its relations of thoracic duct in it. Next, in the superior mediastinum, how the relations of thoracic duct, and finally in the cervical region. So these are the 4 different levels we had discussed the relations of thoracic duct. Next, we will be shifting to the top of the tributaries. Tributaries of thoracic duct. So what are the tributaries at different regions? First, the lowermost part is abdominal region. What are the tributaries in it? Next, in the thoracic region, what are the tributaries? And in the cervical region, what are its tributaries? In the abdominal region, it actually collects the lymph from the lower posterior intercostal lymph spaces. So in the abdominal region, you will receive from lower posterior intercostal lymph nodes. From these regions, they will be draining into the abdominal part of thoracic duct. Whereas in the thoracic region, it will collect as ascending trunks, descending trunk, and the posterior mediastinum. What are the ascending trunk? Ascending trunk is the one which collects from lumbar lymph nodes. From lumbar lymph nodes, simply to say, para and pre-aortic group of lymph nodes. Para and pre-aortic lymph nodes. Whereas the descending trunk is another trunk which is present, and it collects the lymph from upper posterior intercostal lymph nodes. Upper posterior intercostal lymph nodes. LN means lymph nodes. And one more thing, it can also collect from the top posterior mediastinal tributaries. Posterior mediastinal tributaries, which will collect from that of the mediastinum on the posterior side, right? So thoracic duct in the abdominal region, first it collects from the lower part of posterior intercostal regions, whereas in the thoracic part it will collect from the 3 parts. One is the ascending trunks from the lumbar region of para and pre-aortic, and another is the descending, which comes from the upper part of the posterior intercostal regions, and also the posterior mediastinal. The posterior mediastinal is the one which collects from the mediastinum. Now in the cervical region, it receives the tributaries of left internal jugular vein, next internal jugular tributary, left internal jugular tributary, that means which collects from the head and neck region, left subclavian tributary, which collects from the top of the left upper limb, and left bronchomediastinal tributary, which collects from the bronchi and also on the mediastinum. That will be draining just before it enters into the junction of internal jugular vein and left subclavian vein, right? We had said the terminal part is at the junction of left subclavian vein and the left internal jugular vein. Just before that, these 3 tributaries will be received by this thoracic duct. So these are the different tributaries, and these tributaries will collect almost from the entire body except some region. What is that exception is? So I am giving this arrow here, giving a rough diagram how it is collecting. Let's imagine this is a body with the neck, with the trunk, with the 2 lower limbs and the 2 upper limbs. It's a rough diagram for understanding only, okay? I'm dividing this into 2 parts. First part is the left side, the head and neck region, left side head and neck region, left side chest wall, entire trunk, the right lower limb, the left lower limb, and left upper limb. This is entirely drained by thoracic duct. So whatever we have discussed till now, the thoracic duct, it will collect this body, the entire trunk, entire lower limbs, left chest wall, left upper limb, and left head and neck region. Sir, what about the right side? On the right side is actually the right head and neck region, The right chest wall and the right upper limb is actually collected by a right lymphatic duct. And this right lymphatic duct also opens ultimately into the junction of right internal jugular vein and the right subclavian vein junction. Just like thoracic duct. Thoracic duct terminal part is draining into left internal jugular vein, left subclavian vein junction. The same way here also, the right internal jugular vein, right subclavian vein junction, this right lymphatic duct will be draining. Okay, this is what regarding the thoracic duct is. Now we will be shifting to the top thoracic duct and its clinical aspects. See, there is during the surgeries. So the next session is regarding the clinical aspects. So during the surgeries, what happens is the posterior mediastinum surgery is somewhere related to that. The thoracic duct is very minute and there is a chance of rupture of this thoracic duct during the surgeries. So whenever it is ruptured, then there may be damage to pleural cavity also sometimes. Then there will be a fistula between this thoracic duct and that of the pleural cavity, and hence whatever the lymph that is collected in the thoracic duct will be also draining into that of the pleural cavity. So there is a chance. That's the first chance where surgery is the reason. The second chance is a parasite infection called as Wuchereria bancrofti. Wuchereria bancrofti is actually obstructing the lymph vessels. This is a parasite which obstructs the lymph vessels. So whenever these lymph vessels are obstructed, then there will be a swelling. So first is surgical trauma. In surgical trauma, thoracic duct injury may be present along with the pleura. So that will be chyle or the lymphatic fluid. Chyle is also called as the lymphatic fluid may drain into the pleural cavity. And that condition where it is draining into the pleural cavity is called as chylothorax. Chylothorax, where the lymph is draining into the pleural cavity, is called as chylothorax. That's the first clinical aspect that you have to understand. The second clinical aspect is the parasite infection. What is that parasite name is Wuchereria bancrofti. Wuchereria bancrofti. Where does this Wuchereria bancrofti resides is that it actually resides inside these lymphatic vessels. For example, if this is a lymphatic vessel, deep inside somewhere this Wuchereria bancrofti will be here and it is obstructing the pathway of lymph. So whatever the fluid that is left at the capillaries level, it has to be collected by this lymph. So whenever it is not collected by the lymph because of this obstruction, then automatically the fluid will be present throughout that body where the capillaries exchange is taking place. That leads to a huge swollen body called as elephantiasis. Obstruct of lymphatic flow. There is obstruction of this lymphatic flow that will leads to elephantiasis. Right? So this is what regarding the clinical aspect of thoracic duct. One is a surgical trauma, the other is a Wuchereria bancrofti infection.